Hi, and thanks for stopping by. I was watching the news a little while ago, and I saw the demonstrators on the Capitol steps in Michigan, and I hated to even think this, but a video that I made back in February was titled, Is Panic Coming? Panic is Coming. And now I'm adding to that title the words, panic is here. In that video, which I'm going to show you here in a minute, I was inspired by the events that were happening in China at the time. The lockdown, the dragging of people into vehicles, the barring of doors, access doors to apartments, and just all those horrible scenes that we saw with total, absolute authoritarian control. And I talked in my video about if it came to that point in this pandemic that that should those kinds of activities be necessary, how would we as Americans in a free country, how would we respond? So Michigan has shown us, at least today, that they're not taking being controlled by an authoritarian president what they can and can't do. And it's an issue of civil rights, privacy. There are all kinds of constitutional issues going on, as well as the declaration of our president that he has absolute total authority over the states, which just blew my mind, because we have a tribunal government. We have the legislative branch, we have the judicial branch, and we have the executive branch, and it's for checks and balances, so that no one aspect of our government has control. And yet that constitutional issue seems to be threatened right now. So I'm going to go ahead and show you the video that I made back in February. And I don't know the solution. There's so many issues at stake here. The World Health Organization being defunded by President Trump at a time when the underdeveloped countries of the world, which they haven't seen the worst of what's coming to them, because they have no major health facilities in their country. They may not have testing. They may not have hospitals to even think about going to. They don't have public health nurses, and they don't have possibly the CDC in the countries that I visited and that I've lived in. I lived in Central America for 3 years amongst native indigenous peoples, and they lived in tar paper shacks and thatched roof huts with no electricity and no running water and no refrigeration. They can't stockpile food. They can't quarantine because they would have nothing to eat. They have to go out because they make their food available every day, whether it's fishing or picking the fruit that grows freely in the jungles. So my heart goes out to the rest of the world, and if the World Health Organization can't be there to give them some degree of help, then I don't know. So here is the video that I posted a couple months ago. Hi, and thanks for tuning in. The topic of this video is something that's really heavy on my heart. The title of this video is called, Is Panic Coming? Panic is Coming. I'm going to read the narration because that's how I prepare for my own videos, and I wish I could memorize it or be ad-lib, but this is the best I can do because this is really, I think, an important video and topic to discuss right now. Well, this morning I watched a video that inspired me to share my own thoughts about the COVID-19 viral outbreak. The questions are, is it an epidemic? Is it a pandemic? And those are questions that we're waiting to get the answers for. The video that I watched this morning talked about the differences between a communist regime and a democratic society, and how those differences pan out during a crisis situation. Well, today we see the Chinese communist regime's reply in a crisis situation. They initiate quarantine, isolation, they close businesses, travel restrictions, border closures, they force internment, new censorship, viral martial law is basically enacted, controlled commerce, roadblocks, social interaction disruption, cancellation of events, social disorder, attempted social disorder, disruption of communications, control of the news media, forced encampment, restrictions of health information dissemination, lack of medical treatment, prevention of continuity of family communication and personal support, imprisonment for exposing current events. Of course, this is all occurring within the policies of no free speech or civil rights and all that that entails. So, now picture the same scenario in a democratic society. Which of the actions that I listed above would be tolerated? As I reread the list, I'm having difficulty even finding one action that would not be thwarted by the masses. Perhaps quarantine would be unimpeded, maybe. But that would depend on where the quarantine would take place, and viewed alone, with none of the other actions taking place, we might allow a person who has symptoms and confirmed positive test results to be placed in a hospital containment room with medical treatment guaranteed. Would we accept the order to quarantine all persons exposed by this supposed super spreader? Would we allow them to be quarantined at home or in an auditorium identified as a quarantine facility for those with no symptoms? Okay, looking again at the list, we might tolerate the cancellation of large social or athletic events, maybe. Would we tolerate cancellation of religious activities, marriages, or funerals? I imagine that now in China, not only are there no funerals taking place, but I imagine that many loved ones don't even know what's happening to the remains of their loved ones. Would we accept that? If our free speech or civil rights are being restricted, we would lash out and rally, right? No, wrong. Remember, if we're in the middle of an outbreak, we won't be able to gather to rally anything. Would we accept being herded into cattle cars and sent off to a containment facility because we gathered to rally against the cause of free speech or the right to gather? I don't think so. All I see happening in that scenario is rioting in the streets, because that's what we've always done. How would we, each one of us, weigh our rights, our personal rights, against the threat of airborne virus infecting us? If this becomes a national emergency and FEMA is called in to rescue us, and would we go willingly to a FEMA camp for our own good? And what if martial law is enacted and it's forced upon us? Oh my God, if that ends up being the best or only solution, martial law would have to be enacted to force compliance. We would not go willingly. Do you agree? Our freedoms could and will hamper the disease control efforts of our health agencies and medical establishment. We as a society will have to be dummied down to comply with the restrictions that we know are coming. Otherwise, we are all in for an all-out war between the masses and the government. Who will win? Who's winning in China, where there is little rebuttal to the efforts of the government to control the epidemic unfolding there, and now in other countries too? Well, today, Ukraine is trying to prevent the infiltration of their country by those exposed to the virus. There are busloads of people that are either infected or need to be quarantined, and Ukraine has the ability, well, I doubt really that Ukraine has the ability to initiate organized efforts to put social pressure on their government to prevent these busloads of people coming in. And compared to centuries that we've had to put social pressure on protecting our rights to force action, we've had that freedom. But countries like Ukraine is new at defending their rights. And we are used to being able to defend our rights. Will we be able to in the coming months? Well, right now, for the first time that I know of, a FEMA camp in Alabama is being identified as a facility to contain groups of people who have been exposed to a super spreader. Yes, there's a social uproar against the action in Alabama. I believe up until now, all quarantine places have been military sites or public hospitals that have not been opposed to receiving the people who have been evacuated from China or Japan or South Korea or other countries that are reporting pandemic proportions. Well, if, or I should say when, this crisis reaches pandemic proportions within our borders, what will happen? We're not a passive people. We wave banners and we march, we riot to protect our freedoms. How will that fan out in the event of a viral pandemic? Will we comply? Will we lay down our flags and arms and go peacefully into quarantine, into FEMA camps? Well, the only solution I can see to avoid this scenario, disrupting our lives in the possibly near future, is to prepare. Get your supplies in order. Food and water, medical supplies, batteries and flashlights and masks especially, and tapes and tarps and personal hygiene supplies, indoor activities for the kids when we're stuck at home, pet supplies. Protect your independence now while there are supplies available and while there is time to prepare. Well, I hope you enjoyed this, not for pleasure but for preparation and knowledge awareness. And thank you for watching, and if you care about your families and friends and want this information to be available to them, please share the video. Like and subscribe if you'd like to. May your God bless you and keep you safe. I am Natasha. Well, that was certainly an eye-opener. I haven't watched that video, I don't think since I posted it back in February. But just about everything I talked about has come to pass. I don't know what our future holds. I don't know if we're going to go peacefully, if we're going to tolerate extended quarantine and lockdown and stay at home and not work. I know the pressure that we're under is going to disrupt our lives and cause anger to flare and intolerance and kids at home and working from home. These are all pressures on our own mental well-being. I don't know the answer, and each one of you has to decide, do you want to be part of the solution or do you want to be part of the problem, and determine what the solution is that's within your capacity to perform, and determine what the problem is. What's the most important thing? Is it the health of your grandmother that you want to protect and not get this horrible disease that is taking the lives of so many of our elders and those who have underlying problems that need medical care. And those are the ones who are succumbing to the virus. So, just keep your heads straight and don't panic. Although I said panic is here, don't panic. Do your part, your own little part. Wear that mask. When I go down to get my mail, and we have an order here in our apartment building, and it's all seniors that we have to wear masks, I walk out in the hall and I see half the people without masks. And masks only work if everybody wears them. If one person doesn't, then they could be infecting all of us because we're not wearing the N95 masks that prevents us from getting sick. So we have to depend on every single person to wear the mask so they don't spread it to us. That's the only way it'll work. Well, thank you again for watching, and God bless you all. You're in my hearts and prayers.